many donors, especially younger donors who've not ever been through a surgery or anything like this before, we have a donor mentorship program that we're piloting, and it has worked very, very well, where we try to put donors in touch with donors who have similar life situations that have been through this already. And it's amazing when you're 21 years old and still in college to be able to talk to somebody else who's 21 and has done this and didn't have any issues. It's nice to have somebody that you can talk to and talk you through that. We just had 2 donors who literally have gone through their preoperative time period and now their postoperative recovery, and they're talking back and forth. They inadvertently met each other at an event, and now they're using each other as a support and a resource. So we do offer many different things, and that's just one of them.
And the other one, sort of in terms of support, not just specific to Penn, but to all donors, is actually the National Living Donor Assistance.
Yes.
And I forgot what
Absolutely.
the C stands for, NALDAC.
Yeah.
Yes, and we can sort of give viewers the link, but that is a program that it allows donors to get reimbursed for certain things related to donation, travel expenses, hotel, plane flights, things like that. And our social workers, when they meet with the donors, sort of go through with them the qualifications. And it's a way that sort of donors are able to be sort of defrayed some of the costs of sort of having to go through donation, especially those distance donors that need to fly to Philadelphia or wherever it may be. It's a way to sort of make sure that they're not sort of spending that money out of their pocket, and they're able to be reimbursed. And the website for that is now up on the screen. It is something that we go over in detail with the donors, and the social worker will help them fill out the paperwork and do what's needed.
It's very much a needs-based program. It's sponsored by the government and administered through the American Society of Transplant Surgeons. And what it is basically if there is need for, if there's need demonstrated on both the recipient and the donor side, then they provide them with a small grant. They actually get a little American Express card in order to help cover travel expenses and expenses like staying at a hotel if they have to, and if they come for evaluation. It can't cover things like lost wages or things like that, but it certainly does help with a lot of the little things that occur when you have to come, for multiple visits to be a living donor. So it's really a great resource.
40% of our donors are distance donors, so it has proved to help so many of them, especially with airline fares and stuff like that, as we've said. So don't feel that you need to live in the Philadelphia area to be a donor for a loved one here at Penn. We are able to we look at donors from all over, from Seattle, Washington, North Carolina, Florida, Texas. And we're willing to help as much as we can with making this a seamless process for you.
And we've been focusing on the donors, but we don't want to forget the recipients. Our social workers are very much involved with the recipients from the minute they come to Penn for evaluation. And they're involved with them forever, from the minute they come for evaluation until the time, until go through the transplant and afterwards. And we have a liver transplant support group that they organize and care for. We have a lot of support in getting financial assessment from our financial coordinators. They work on finding the right place to go if people need rehab or skilled nursing after transplant, and all those things are organized by our social workers, who are fantastic.
Right, and sort of adding that to the part about recipients, who we haven't been talking about as much, living donation at Penn and living donor transplant is not only available to patients that we see at Penn that are waitlisted at Penn, and we have had recipients and or donors that have sort of referred their loved one that they were sort of on the wait list at another center, but thought that, maybe my dad, my uncle, whatnot, maybe they do need a living donor, and we are sort of happy to accommodate patients like that and to evaluate sort of first the recipient to make sure they are a candidate for a transplant, but then the donor as well.